Our team has generated a response plan on what to do regarding a radiation exposure event, specifically a dirty bomb in the El Paso border metroplex.
In order to better understand what radiation is, we must first understand how it's measured. In the US, the term RAD is used, which stands for radiation absorbed dose. This term is used to measure high-dose acute exposure. However, REM is used to measure or to estimate the amount of low-dose radiation that is absorbed in chronic situations such as occupational hazards. Around the globe, the term gray is used, which in essence is 100 rads equals 1 gray. Sieverts are also used around the globe, but this is used more to describe the effect that it'll have on the biological systems that radiation is affecting.
Now we're going to talk about biological effects of radiation. Depending on the ionization, it can be more harmful than others. As you can see on the left side of our graph, it can penetrate through paper, metal, hand, water, concrete, and lead.
Our team wanted to cover the effects of acute radiation syndrome and what to do in the event of a nuclear attack due to the historical significance that we've seen in the past. In 1945, the atomic bombings of Hiroshima and Nagasaki. In 1979, 3 Mile Island accident. In 1984, the Juarez nuclear spill. In 1986, Chernobyl. In 2011, the earthquake tsunami that damaged the Fukushima Daiichi nuclear power plant in Japan. For this reason, we must be prepared. Closer to home, the Juarez nuclear spill of 1984 was a disaster nobody could have predicted. About 200 people were exposed to radiation when a cancer therapy machine from Centro Médico de Especialidades in Ciudad Juárez, Chihuahua, Mexico, was sold at a junkyard as scrap metal for $9. About 600 tons of the contaminated steel was shipped to the U.S. between December 1984 and January 1985. The spill and contamination was discovered by accident when a delivery truck took a wrong turn near Los Alamos National Laboratory in New Mexico, and radiation alarms were tripped.
For this presentation, we selected specifically a dirty bomb, and this is a type of radiological dispersal device created by combining explosive and radioactive material to cause radioactive contamination upon explosion.
Before the El Paso borderplex region is able to respond to a dirty bomb, we must understand the current population of the region, which sits at 2.5 million people. This region is a combination of Las Cruces, New Mexico, El Paso, Texas, and Juarez, Mexico.
The population that will be the most affected in this area are the Hispanic or Latinos with 82%, whites with 13%, 3% of African Americans, and 2% of Asian Native American and others.
Community partnerships are extremely important and vital to have in the event of any radiation exposure. Local radio stations will help disseminate information to the public on what to do and what precautions to take. The City of El Paso's Department of Public Health offers classes on radiation preparedness, and they also provide infographics on the different types of radiation exposure there are. The American Red Cross offers information on how to survive before, during, and after a radiation disaster. They also include survival kits that are available for purchase. The UTEP emergency broadcast will help send text alerts and information to students, which will provide crucial information on what to do and what needs to be done during the radiation event. It is important to be prepared in advance in the event of a dirty bomb detonation. Families should have a family disaster plan formulated, which should include out-of-town contacts and locations to reunite in the event that you are separated from family or loved ones.
Special populations at a higher health risk include children, pregnant women, nursing women, immunocompromised individuals, and individuals with language barriers. For those that are immobilized, it is wise to have a manual wheelchair in case the radiation rays interfere with the electrical wheelchair they might be using. A medical alert system that will allow the elderly and people with disabilities to call for help by the push of a button is also recommended. And for those that are vision impaired, deaf, hard of hearing, or also those that are immobilized, they must plan ahead to have more than one person to convey information to them or provide them with assistance in the event of a radiation emergency.
If institutionalized individuals happen to not be able to relocate and stay on the scene, they are advised to do the following. Avoid touching contaminated surfaces, keep hands away from face and mouth, carefully remove outer clothing and place in plastic bags. If showers are available, to wash their body thoroughly, or at minimal to wash their hands and face. If water is not available, they are advised to wipe hands and face with moist towels or disposable wipes. Stay tuned by radio, television, or other available sources for further instructions from first responders. Radiation doses for first responders should follow the ALARA concept, which stands for as low as reasonably achievable concept. Design and emergency response plans to follow this concept protects first responders' overall health. Assuming that Fort Bliss was hit by a dirty bomb, an alert would first be sent out to the El Paso population by several sources to ensure that the alert is received by all special populations.
As part of our public health response, areas of diagnoses would be set up. There would be an area for triage, an area for treatment, and an area for follow-up. In our response plan, triage locations would be major hospitals. Major hospitals have greater number of beds. They are geographically dispersed to attend to most of the border metroplex. They have highly qualified medical personnel, in-house pharmacy and laboratories, and access to imaging and equipment that would be needed to assess and treat radiation exposure. Some examples of these hospitals would be, on the far west side, the Hospitals of Providence Trans Mountain Campus. In central El Paso, UMC Medical Center. In northeast El Paso, William Beaumont Army Medical Center. In Las Cruces, New Mexico, Mountain View Regional Medical Center. In Ciudad Juárez, Chihuahua, Mexico, Centro Médico de Especialidades. Medical personnel in the triage locations would use radiation dose assessments, vital signs, lab results to include CBC with differential, Chem14, thyroid function test, PT or PTT fibrinogen tests, urine cultures, blood cultures, EKG results, urine and serum HCG test results, imaging results, and wound care urgency to determine the best appropriate care for each individual affected. Treatment would be delivered in the hospital setting and would include decontamination, removal of clothing, and washing with soap and water. It would also include supportive treatment to treat dehydration, infection, nausea and vomiting, fever, diarrhea, rash, itching, pain, skin burns, and any other symptom associated with radiation exposure. Bone marrow treatment would also be available with granulocyte colony stimulating factors such as Neupogen, leucine, and Neulasta. Treatment for internal contamination would be with potassium iodide, Prussian blue, diethyl triamine pentacetic acid for the treatment of neutropenia and fever, and prophylactic treatment for DVTs and antimicrobial prophylaxis. This would lead to either recovery or end-of-life care. Our response plan recommends follow-up treatment be conducted at area clinics and doctors' offices around the border metroplex. This would help separate the sick patients being treated at the major hospitals with the recovering patients, thus facilitating containment. These area clinics and doctors' offices would still be staffed with highly qualified medical personnel, and some clinics and offices would have in-house pharmacies, laboratories, and diagnostic equipment to facilitate the follow-up treatment. In addition, there would be a line of communication between attending physicians at the major hospitals and the follow-up treatment doctors in order to provide continuity with treatment. Some of the example locations would be on the far west side, the Upper Valley Urgent Care Center. In central El Paso, Texas Tech Medical Center. In northeast El Paso, Providence Urgent Care Clinic. In Las Cruces, New Mexico, Las Cruces Urgent Care Clinic. In Ciudad Juárez, Chihuahua, Mexico, Hospital Ángeles de Ciudad Juárez. Patients receiving follow-up treatment would expect to receive radiation dose reassessments using biodosimetry, follow-up labs, radioisotope decorporation or blocking agents, treatment for neutropenia, fever, antimicrobial prophylaxis, pain management, nausea and vomiting, diarrhea, dehydration, and gastrointestinal issues. In addition, they would receive medication management, nutrition assessment, cancer screenings, mental health screenings, DVT prophylaxis, and wound care.
Some areas of surveillance in El Paso after a dirty bomb detonation would be areas, for instance, Fort Bliss, White Sands Airport, any satellite imaging that will detect these radiation spreads, Environmental Protection Agency, specifically RadNet. The darker red are high impacted radiation, and in the lighter red with the dots on it are places you can find clinics, but most definitely, locally, we'll have a hub in Fort Bliss. We would be tracking weather, wind, precipitation using National Oceanic Atmospheric Administration. Be aware of some diseases that could occur or health detrimental occurrences. For instance, cancer, so you can see thyroid, leukemia, lymphoma, multiple myeloma, breast cancer in females, lung, pancreas, uterus, rectum. Anything that's damaging to the DNA is going to lead in mutations, which result in birth defects in the offspring, blood protein mutations, chromosome aberrations, cancer, and even further mental disorders. From a public health response, some treatment goals. First and foremost, prevent radiation contamination, treat life-threatening injuries, for instance, burns or trauma that occurred elsewhere on the body. A lot of the patients experience chronic pain or long-term pain, something of that nature. Treatment immediately is going to be decontamination, removing clothing, shoes, gently washing with water and soap. If needed, platelet transfusion, antibiotics, blood transfusion, fluids. Treatment for bone marrow is going to be using a colonizing stimulating factor that promotes growth of white blood cells. We have medications like Neupogen, Leukocaine, and Neulasta that you can use for those. This would be used in patient setting. Treatment for internal contamination using medications like potassium iodine, Persian blue, DTPA.
In the incident of a dirty bomb, the healthcare response team must work quickly and efficiently to treat all its patients. There are 6 important components to the healthcare response team. They are notification and communication, triage, patient management, healthcare provider protection and resources, surveillance, and community planning. Large facilities in the El Paso area that may be used for triage and contamination control include the UTEP Sumble Stadium, the Don Haskins Center, the El Paso Convention Center, Southwest University Park, Fort Bliss, the SISD Student Activities Complex, or also known as the SAC, or any other high school gymnasiums across the city.
Pharmacists and pharmacists' role during radiation emergency. Establish a network of healthcare professionals to participate in emergency preparedness, planning, and volunteering in the event of a radiation emergency. Prepare for a radiation emergency by stocking and maintaining emergency supplies and medications. Advise public health officials how to convey information to the public about proper medication use in the event of radiation emergency. Counsel and educate the public on proper medication use post-radiation exposure. Interns and students must follow the pharmacy's emergency response plan, take orders, instructions from pharmacists. Help stock the pharmacy with PPE and dosimeters, radiation detection and equipment. Assist in the triage process and collect medication history. Organize hospital order forms by patients with the highest risk of exposure to contamination. This is an algorithm of a hospital approach to patients presenting after a nuclear detonation. So the first thing you need to look at is the patient is on trauma. If that's the case, you need to look if the patient is ambulatory. If yes, you need to temporizing care, spleen, bandage, reduce. Initially, unless resources available, consider early GSF, if available upon ALC or epidemiologic information. You can just refer to alternate care site or clinics. If the patient is not ambulatory but he has an emergency of operation, you can just perform the surgery. If not, you can just monitor the clinical condition and reoperate if necessary.
Planning for emergencies is not only responsible, but it saves lives. Our team has generated an emergency response plan for the El Paso Borderplex region that would guide our citizens in the event of a radiation exposure, specifically a dirty bomb. Our response plan has been adopted from safety protocols and procedures set forth by different agencies and entities. For example, we use the CDC, the U.S. Department of Health and Human Services, the Mayo Clinic, and the Texas Poison Center Network were just a few that we referenced in our video. These references have been used to tailor and meet the specific needs of our community region.